I know cancer is one of the sectors where this is being applied. I know there are a number of clinical trials that are also in the design phase. What kinds of cancer can really benefit from this approach? What are the key insights to determine what kind of patients could benefit from this tool?
Yeah, and that's a really good question. So I would say the cardiovascular studies, and we're doing work with carotid and heart failure and some in peripheral arterial disease. I think those are much closer to being more, it's like the translational diagnostic or therapeutic side of it. For the cancer side, it's much more early research at this point, and a lot of the work we're doing on the cancer side is trying to understand what is it about the circulating tumor cell that is causing it to have higher residence time. So it's more like really understanding the mechanical properties of those cancer cells, that like why are they having a higher residence time, what could be causing them to have more like metastatic potential, where it's opening up, if we can identify that it's something as simple as like the stiffness, it's like then you should create a therapeutic that's going to address that component. So it's like helping us where the computer simulations can leave absolutely everything the same and then change the receptors on the cancer cell and the exact location and placement of the cancer cell. So it gives you that opportunity to really figure out, okay, if I change the adhesiveness of this specific receptor and have it at a different pattern, I'm likely to have more of a residence time. Like we've been doing a lot of studies where it even, where we have a microvascular network and it'll change the path that it takes in the microvascular network based on these properties. So it helps you, it's much more early stage research, trying to see like what is it about the cancer cells that are going to make them go in a different direction that can then inform therapeutic design or that side. There's other areas where it's, trying to use the digital twins to make, we've done some work where it's like trying to create like the radiation and chemotherapy scheduling and trying to optimize like what's the time difference, but like, after you've had radiation, when should you have chemotherapy and how do you optimize that for different cancer lines? And that's a little bit closer to being translational, where you're figuring out the schedules that should be tried in human trials. But the cell-cell interaction on that side is a little earlier on. We're starting to work with teams that are, creating the point of care, like blood draws, where you can do, having real-time analysis of what's happening, how things are changing. And I think there will be, but it's hard to tell when.